The comorbidities that are most common would be allergic rhinitis. You can have sinusitis with nasal polyps, it's commonly seen, gastroesophageal reflux disease, and it can be acid or non-acid reflux, and upper airway dysfunction. We call it intermittent laryngeal obstruction or vocal cord dysfunction. It has a few different names. Obstructive sleep apnea is a big one. So those are probably the most common. Depression often comes along with having chronic and especially severe asthma. It goes along with the territory. Really important to address that. And in some cases where obesity is an issue, because we do see a fair number of patients with severe asthma who are obese, you worry about metabolic syndrome, diabetes, heart disease, all the things you would worry about, in any patient with obesity, because that can also add to the symptom and medication burden. I think the key factors in addressing comorbidities are really taking a good history, because you want it, for instance, allergy is a good example. You want to make sure there's a good clinical history of allergy, and then you can do the skin testing or the blood test to look for allergen-specific antibodies, but you've got to put it together with the clinical history. Is there a seasonal component? Is there allergic rhinitis? Do they have other manifestations of allergic disease like atopic dermatitis? Important to get a really good history to go along with your skin tests or other tests for allergy. I think the same holds true for reflux. Some patients don't have obvious reflux symptoms, but they may have throat closure or sore throat or change in voice that actually might be reflux. They may manifest in different ways. They might have a hiatal hernia that promotes reflux. They may have a family history of heartburn. So you really want to delve in and really decide if a patient has a comorbidity. Sleep apnea. Do they have morning headaches? Do they have daytime fatigue? Do they fall asleep easily doing tasks? Are they overweight, which would also predispose to sleep apnea? So those kinds of questions, really delving into each of them so that you, one, feel assured that it's something that's real, and then two, especially if you're going to be doing some testing, that'll give you the evidence that you need to pursue testing to make the diagnosis.